The federal government has disclosed plans to commence the administration of booster dose of COVID-19 vaccine to counter the spread of the new Omicron variant in Nigeria. Executive Director of NPHCDA, Dr. Faisal Shuaib, who gave the indication at the flag-off of COVID-19 mass vaccination of refugees, migrants, and internally displaced persons in Abuja said, the exercise will kickstart on Friday, 10th December 2021. He said the development is in view of the recent detection of the Omicron variant of COVID-19 in the country, which necessitated the need to review the nation's vaccination program and the resolve to introduce the booster dose. He said the development is in view of the recent detection of the Omicron variant of COVID-19 in the country, which necessitated the need to review the nation's vaccination program and the resolve to introduce the booster dose.
Evidence has shown that the booster dose further increases protection against the virus. Eligibility for the booster dose includes being 18 years and above, fully vaccinated with either 2 doses of AstraZeneca, Moderna, or Pfizer-BioNTech, or a single dose of the Johnson & Johnson vaccine. The time interval before the booster dose is at least 6 weeks for these vaccines, except the Johnson & Johnson vaccine, which is at least 2 months.
Shuaib, who spoke on reasons that informed the induction of the Mass Vaccination Campaign, said it is to ensure equitable access to COVID-19 vaccines by everyone.
Our presence here today to flag off the vaccination of our brothers and sisters in this camp across the country is also a fulfillment of that determination. Everyone, no matter where they are in the country, must have access to the COVID-19 vaccines.
In her remarks, the Federal Commissioner for National Refugees, Migrants and Internally Displaced Persons, Suleiman Ibrahim, said, statistics from the United Nations High Commission for Refugees indicates that over 3 million internally displaced persons reside in various camps across the country, hence the importance of the vaccination exercise.
These persons of concern have had their livelihood eroded by both man-made and natural disasters, such as the protracted fighting, insurgencies and insecurities, communal clashes, and the consequences of climate change, leaving them more vulnerable to COVID-19 pandemic and larger impacts. The majority of them lack access to an adequate healthcare facility and are stigmatized as a result of their situation. This is why the Commission is collaborating with the National Primary Healthcare Development Agency to ensure that COVID-19 vaccine reach our vulnerable persons of concern.
Statistics from the NPHCDA suggest that as of December 9, 2021, over 7 million Nigerians have received the first dose of the COVID-19 vaccine, with 3,846,762 others fully vaccinated. Ugochi Obaja, CNN News.